Hello viewers, my name is Dr. Sarwar Chaudhry from Australian Polyclinic in Lahore. We're going to talk about the different causes of blocked nose or congested nose. As you may be aware, this is a very common problem and we do encounter it from time to time. And there are plentiful causes of blocked nose, but luckily there are only few which are the most common. So talking about the common causes of blocked nose, the top of the list would be infective rhinitis or flu-like illness. When the flu viruses like influenza A or B or rhinovirus or common cold virus cause infection, the most common symptoms we get is initially little runny nose, which can get blocked due to thickened secretion later on, and it may take quite a few days to settle. Then the second common cause is infection in sinuses or sinusitis, which would cause thickened secretion to build up in the sinuses along with the congestion in the nose, and those secretion may come from the front or back of the nose or postnasal tract. Other common cause of persistent nasal discharge or congestion is allergic rhinitis or allergic rhinosinusitis. It is basically allergy of the nose and sinuses due to various allergens like pollens, dust mite, among many other allergens. These patients they tend to get more symptoms of runny nose and congestion when they exposure to pollens, like in the spring season. Other times they may not have a lot of symptoms. And the other causes of blocked nose could be, especially in kids, a foreign body which may be stuck in the nose but may not be aware of that. That may cause a very foul smell, nasal discharge, and generally they have a problem only on one side. Other problems that may come across are unusual, like inflammatory nose conditions, Church-Strauss syndrome, which is a rare autoimmune disorder, and polyarthritis, and those are sometimes can cause a problem, but polyangiitis is more common problem among all autoimmune diseases causing a blocked nose. It is generally associated with bloody discharge, and there will be many other symptoms from other parts of the body being involved with the disease process. Another common disorder I would like to talk about is sleep apnea, that may cause or present with a nasal blockage, and they have difficulty breathing during the sleep. These patients normally complain of snoring and morning headache and increased sleepiness during the daytime. These patients tend to have a high BMI or body mass. In children, adenoid enlargement or hypertrophy can present with blocked nose, and they also generally associated to have enlarged tonsils and recurrent episode of tonsillitis. So as you can see, there are many different causes of blocked nose, but the most common being infection or viral infections. Generally speaking, viral infection don't need any treatment except symptomatic treatment with paracetamol for the general symptoms of malaise or fever. If there is any significant nasal congestion, we can use the saline washes to help clear the nasal secretions. In patients who got allergic rhinitis, they may need to use some sort of nasal steroid to control their symptoms, which sometimes we do combine with nasal antihistamine. There are a few medications which are called decongestant. They cause a vasospasm of the arteries and reduce swelling and secretion, and these are designed only to be used for not more than 3 days, as they tend to cause rebound rhinitis and a significant nasal congestion. So if you have got symptoms which are lasting for more than a week, or you have got a colored discharge or significant pain in the sinuses or significant ongoing fevers, and these are generally the symptoms when you should try to contact your nearest physician for further assessment.